Thank you. COVID-19 cases have topped 1,000 for the past 2 days here in Arizona. While cases are well below what we saw over the summer, they are increasing at a rate we haven't seen in months. Mark Thompson is live this morning for us. Mark, the governor is going to address this situation this afternoon.
Yeah, good morning to you, Nick. And we haven't heard from him in a while. He is expected to host a news conference later this afternoon. He hasn't answered any questions about the pandemic for almost a month, since late September. But since his last news conference, the state health department reports that cases have increased by about 57%. Last week, there were nearly 6,000 cases, and this week is on track to surpass that. Some health professionals are now on record that Arizona is heading into another COVID-19 wave, and the executive director of ASU's Biodesign Institute says that we could be heading into a very difficult November, and the director of the Department of Health Services took to YouTube to tell Arizona to stay vigilant.
We know that the policies that were put in place last summer worked. There's no doubt that they worked. So it's a good time to be considering those sorts of policies until we can establish more herd immunity.
The increased cases and percent positivity show that COVID-19 is still actively circulating in our communities. Arizonans need to remain vigilant.
And we've talked about this for the past couple of weeks now. There are two things that all Arizonans are being asked to do by health officials, and one is don't wait, get your flu shot now, because you don't want to be dealing with both flu and COVID-19 at the same time. The other is, of course, get tested for COVID-19. Now, that should be a little bit easier than it was even a month or so ago, as there are now 500 sites across the state, so there should be ample opportunity to get tested for COVID-19 as well. Reporting live this morning, Mark Thompson, ABC 15 Arizona. Guys, back to you.
All right, Mark, thank you very much.